Hi everyone, your lab this week is Introduction to Dissection and Animal Nutrition. This should be telling you that you're going to be concentrating on the digestive tract of this mammal and looking into that very specifically. And you will also cover some of the other systems as well. That is part of respecting the fetal pig that you have there. If we are going to do a dissection on an animal, we are going to show you many different systems to show respect for the animal and what the animal can teach to us. The reason I am making up this video is because some of these points about the digestive system of the pig and about other systems are not well pointed out in the video on the dissection that I want you to look at, and they are not very well pointed out on the lab website, but they may show up in your final exam, and I want you to be prepared for that. So let's start in, and the learning objectives for this lab are that you should be able to understand the taxonomic classification of this fetal pig. We'll get into that. And then, of course, we're going to look into some of the external landmarks that are not well described. Let's talk about the respect for this pig. This is a fetal pig that is used quite often in labs like this because of their manageable size. They're about 10 inches or so. They are low cost, they're frequently available, and most importantly, they have anatomical similarities that are very close to humans. The term for that, and you should know this, is homologous structures. Homo meaning same, homologous structures. They have structures which are very similar to human structures, and therefore they're a great model to study. The gestation period for fetal pigs is normally about 16 weeks. The ones that we are getting here are normally about 12 to 14 weeks gestation, so they're about 10 inches long. They possess a fully developed organ system, much like a human baby would be fully developed about 2 weeks before birth as well, before a full-term birth. Now, in terms of respect, these pigs were not bred for this lab. These pigs were actually harvested from pregnant sows that went to slaughter. If these pigs were not being used to teach you, they would be discarded, but instead they are valuable in their teaching for you and they deserve your respect. During Bio 1, you'll do a virtual dissection, and during Bio 2, you'll do a live dissection. Not a live dissection, but you will do a dissection at CCM with a fetal pig. This one will be virtual instead to get you ready for it. When we look at the taxonomy of the fetal pig, it's a little bit different from what you are used to, because you're used to a name that includes 2 words to it for the genus and species, like Homo sapiens. But this has Sus scrofa domesticus, and that's 3 names. We're going to go into that a little bit so you understand more about it. In the meantime, you see that this highlighted area is very familiar because all of this was for Homo sapiens as well. Eukarya, Animalia, Chordata, Vertebrata, and Mammalia. All similar to Homo sapiens. If you have any questions about any of those kingdom, phylum, subphylum, class, go back to your Homo sapien PDFs and your Homo sapien videos for that. Then they tend to move away, and when it comes from order down, the fetal pig moves away from our common ancestor. And we are going to be looking at the fact that these are of an order of artiodactyl, which means even-toed hooved mammals. If you think about it, we have 5 digits in each arm and each leg, digits meaning fingers or toes in each arm and leg, but the pig does not. The pig has 4 toes in a hoof, and we'll explore that a little bit more. In addition, the family is Suidae, which is for large heads, short necks, relatively small eyes compared to the head, prominent ears, compared to the head, a snout with a disc-shaped nose, a bristly coat, a short tail, and a tassel. Now, you get into genus and species. Genus is sus, which is Latin for swine, and it refers to the snout, really, that is more specialized in this genus. This genus also has a one-chambered stomach, much like a human stomach, and a highly social behaviors, which lends itself to the next species. The next species is Scrofa, which sounds a lot like scraping, and it refers to that from the Latin. It is having the behaviors that are scraping at roots and digging at roots, which of course pigs do. So these are sus scrofa, but you see there it says it's for wild swine. And then they put on a subspecies for domestica. So that what they're saying is that these pigs over time were selectively mated in order to produce a domesticated pig that relies on humans for a food source. So there's a symbiotic relationship there. Humans rely on pigs for a food source, and pigs rely on humans for their food source. That's what domestication is. It happens over time, and these were an evolved subspecies from a wild boar or a wild swine. So it's Sus scrofa domestica. You can also see it just Sus domesticus. Hope that explains that to you. I want to go over something that is not well explained in your folders that you may need for your final exam, that the ear flap in a pig is called a pinna. Both ear flaps are called pinnae, the plural. And so you should know about that. You should be able to identify what is on this slide, because this slide could be on the final exam with all of the anatomical landmarks covered, and you would fill in the names of the anatomical landmarks. I have a feeling that pinna is a very important one, and you should know that for the ear flap. You will hear about the other landmarks in your other videos, and they do a very good job, but I just think they didn't get into the ear flap. And I also brought this in because there's not much in the information that you have in the other folders in regard to the pectoral region. You will need that for your report sheet. The pectoral region are your pecs, your pec muscles, your chest muscles. They are in this area, which is labeled P, but the P is for plural, the pleural cavity. The pleural cavity is where the lungs are. But if you want to use it as a mnemonic, that's fine with me. The pectoral muscles would be the chest muscles on the ventral side of the pig. Remember, ventral side is like ventilation, like lungs. So that is the location of the pectoral muscles, right above the diaphragm. You will get a really good description of the diagram in your material that you have. So I'm not going to go over that. But you don't have a great description of the pelvic cavity. And the pelvic cavity is below the abdominal cavity, and it's marked by the pubic symphysis bone, but it is quite narrow, you see there. So that the uterus is generally in the pelvic cavity in females, and you see that it is a bit constrained. I wanted you to know that as well, because that's not well outlined in the other material. In addition, I have a more detailed explanation of the legs of the pig that I hope that you will take on and make some note of. If you were thinking that this pig could be bipedal, like a human, then you might think that these are the legs that the fetal pig might stand on, his back legs. And you might think that his front legs would be his arms. If you do think that way, you will see where the anatomical landmarks are for the pig. For instance, if we start proximal and move distal, we might say that this arm of the pig has an elbow here, and you can kind of see that shape for the elbow right there. And this arm has a wrist right here before it gets into its digits, which are distal on the leg. This is going to be a 4-digit animal, and there's more information in the videos about that, but it's something to think about, that you are looking at what is essentially, maybe you could think of it as a bipedal animal with legs and arms, and you reference this joint as an elbow, this joint as a wrist. If you look at the back legs, you are referencing in a proximal way, you're referencing this bulge as a knee, like a kneecap in this bulge here. And you are referencing this joint as an ankle. And it really does kind of look like an ankle. So I wanted you to know those anatomical landmarks as well, because they, again, are not brought up well. In addition, the umbilical cord is a big deal, and I want you to know this for your final exam. On the other hand, it is very difficult to find a good graphic of the umbilical cord. And very importantly, I want you to understand, as I'm sure you know, the umbilical cord protrudes from the ventral side of the abdomen. That's the easy part. In the umbilicus, there is one umbilical vein. There are 2 umbilical arteries. And I want you to really underscore that the vein is moving blood toward the fetus, much like our veins will move blood back toward our heart. This umbilical vein is moving blood toward the fetal heart. And as such, it is bringing in oxygen-rich blood. You may not think of a vein as bringing in oxygen-rich blood, but the term for vein really is for moving blood toward the fetus heart. And that is what you are doing with this umbilical vein that comes from the placenta. That umbilical vein with oxygen-rich blood that is going toward the fetal heart is here in the umbilicus. If you look here, here is the head. I even switched this around. You'll see this is backwards, but most of your renderings and graphics have the head on the left-hand side of your PowerPoint and the legs on the right-hand side of your PowerPoint. That's why you're seeing this flipped. So toward the head, or cranial, you will find one umbilical vein, and toward the tail, or caudal, you will find 2 umbilical arteries. Let's talk about those arteries. Those arteries are carrying metabolic waste products and carbon dioxide away from the fetus. And the way to remember what arteries do, arteries carry blood away from the heart of the fetus. So you can remember artery, away from the heart, which also has an A, from the heart of the fetus. There are 2 of these arteries in the pig umbilicus. This is the same setup for fetal circulation as humans have. So it's important that you learn this. That said, this drawing, which is good for many things, including locating this cranially and caudally, is not good for color. And this graph is wrong for color. This umbilical vein should be red. So I highlighted it red. It should not be blue. Please remember, veins move blood toward the fetal heart. And these 2 umbilical arteries should be blue, because arteries move blood away from the fetal heart. So please keep that in mind, because there will be circulations that will be different from what you may have learned when you were in simpler classes. But this is the classic definition for artery. please study this drawing. You will need it. It will definitely be on a final exam. And you note here that this happens to be a correct diagram